I'll try to work with Laura behind the scenes.
Okay. We'll get started. Welcome, everyone. I am Adriana Semko. I am the program coordinator for HIM and your host for today. And we're excited to have you all with us. I'm going to introduce all of you. And just a forewarning, I have been told there has been some issues with Zoom going on. If something does happen, feel free to log back in. We'll get it restarted again if we do have any issues. We have 5 panelists with us today. We have Karin Schönensberg from Community and Behavior and Health. She is a graduate of SUNY Poly with a BS in Community and Behavior and Health. Her professional interest areas are mental health support and social emotional learning to promote positive outcomes in children and adolescents. Prior to assuming the director role for LPP, Karin worked for several local nonprofit agencies serving vulnerable populations experiencing mental health and substance abuse. Karin is currently working on a master's degree in social work. We also have Stephanie DePerno. She is our HIM alum. She currently works for the Office of Mental Health at the Central New York Psychiatric Center. Stephanie graduated from SUNY Poly in 2013 and started working with CNYPS as a health information management technician. In 2018, she was promoted to her current role as HIM director for the inpatient setting, and she has earned her master's in technology management with a concentration in health informatics, also from SUNY Poly. Michelle Phillips, we're representing health informatics and HIM, as she's a graduate of both programs. She's a dedicated professional in the health information informatics field, combining a strong background in medical coding with a passion for education and student development. She's currently serving as a medical coding supervisor at Frontier Science, Technology, and Research Foundation in Amherst, New York. She has 18 years of experience in that organization. And she also has her RHIA and CPCA. Next, we have Stephanie Higginson with us. She'll be representing one of our nursing programs. She was appointed as the Chief Nursing Officer and Vice President of Patient and Clinical Services at Columbia Hospital in January 2022. In this position, she has implemented a nurse residency program, reduced hospital-acquired conditions, improved nursing recruitment and retention, and is leading the organization on its first ever Magna journey. She has accrued decades of nursing experience and senior leadership. And next we have Laura McMillan. She's also representing nursing. She started her career as the nurse's aide at St. Mary's Hospital in Troy. She earned her RN from Samaritan Hospital School of Nursing. And Laura continued to work at St. Mary's for 6 years. Laura has her master's in science from SUNY Poly, earned in 2019, where she was on the president's list and the president's excellence list several times. And we're excited to have you and learn about your journeys here at SUNY Poly and where your career has taken you. Let's start out with Laura. And tell us a little bit about yourself and some of your nursing, some of your past in nursing, and where SUNY Poly has taken you. I think Laura's still having technical issues, so maybe we'll save Laura for last. And let's start with Karin.
Good morning, everybody. It's so wonderful to be with you all and share just a little bit about my personal journey with CBH and with SUNY Poly. I had the privilege to attend from 2015 to 2020 in the Community and Behavioral Health program. During the 5 years that I was there, I learned under some absolutely amazing professors, one of which is here with us today, Dr. Joanne Joseph, as well as Veronica Tishner. I was provided several wonderful opportunities to participate in special projects, including a partnership with CABV that detailed a collaborative partnership with our engineering students and our CBH students. And we provided and created Braille blocks to assist in educational development of students that were attending at CABV. We also had, during our capstone project, a mixed method study of the impact of ACEs on Head Start. So with the mix of psychology, sociology, adverse childhood experiences, and biopsychosocial education, that provided me a great foundation to enter into youth support directly in the fields of mental health, substance use, and in my current role as Liberty Partnership Program Project Director now. So prior to assuming this role, I spent some time working for Center for Family Life and Recovery, a local human service agency. And I spent 3 years engaging with youth, specifically providing substance use education, mental health education, and social emotional skill building. And from that, I had the amazing opportunity to return to SUNY Poly and to serve as the project director for the Liberty Partnership Program. Just a little bit about LPP. We are one of 50 constituents across New York State. We serve over 200 students across 6 contracted Herkimer County districts. We work with them day in and day out, my staff and myself. We provide in-school-based after-school programming, one-on-one academic support meetings. We provide civic engagement and SEL groups. And we also bring our students as often as possible to SUNY Poly so that they can begin to embrace the college environment through career development and career exploration days, and through annual summer camps. So that's just a little bit about my journey and what's brought me to current day.
Stephanie DePerno, what about you?
Hi, can you hear me? Just wanted to make sure.
Yes.
Okay. So when I went to SUNY, at the time it was called SUNY IT, for my undergrad in health information management, and I loved the school. I thought it was a really great experience. I made some great friends and had great professors and really learned a lot. And I ran cross country and joined all these teams and was really involved. And one great thing I think that started my career was that in the health information management field, we do internships where we have a 2-week internship, and then we have another internship where we visit various places, and then we do a 3-week internship. And when we were doing our second one, which is when we visit a bunch of different places, we visited Central New York Psychiatric Center, and they talked about how they were going to have opportunities in the future for job openings. And to me, that stood in my head like very important. And I decided to do my 3-week internship at Central New York Psychiatric Center during my last semester at SUNY IT. And I really enjoyed it, and I did a good job. So they hired me, and a month after I graduated, I started at Central. And Central New York's a facility that is with the state, New York State. We have the criminally insane in our building. So we have patients that are coming from docks, they're coming from county jails, and they need psychiatric services. And then they come to Central New York, and we take care of them, stabilize them, go over any issues with them until they're ready to go back to where they came from. So I started as a HIM tech, so it's basically the lowest level, and I worked my way up to HIM director, which I am right now. And during that time, I decided that I wanted to go back to school to get my master's because I didn't want to prevent myself from reaching a certain point and not be able to go any higher. And obviously, because I had such a great experience at SUNY IT, I wanted to go back, but at the time they're called SUNY Poly now. And I went back and had another great experience. The professors were amazing, and I can't say anything nicer about SUNY Poly, and really enjoyed it there. And I have been working at Central the whole time, so really gone together.
Thank you, Stephanie. Michelle?
Hello. I am one of those very non-traditional students. I was actually working in a bank when I started my journey with SUNY Poly in the health information management area. I had taken a coding certification through Brian Stratton, and on a whim, put an application in for a position that, according to their qualifications, I was absolutely not qualified for. But they did end up hiring me, and I have been working. I started as a coder at Frontier Science in 2007. I've been there ever since. In 2020, I was promoted to the coding supervisor, and have been there in that position since then. The non-traditional student of me is that I did start at SUNY Poly back in 2011, working on my bachelor's degree in health information management. In 2015, I had to take a break from school. I took a 4.5 year hiatus from school to take care of my father, who passed one semester before I graduated. I did end up going back into school, I think I had 6 classes to finish my bachelor's degree when I returned in 2019. So I was able to get those done, graduate with my bachelor's in 2020, and then I jumped right into the MBA master's program because the master's in health informatics had not yet been approved from the state. As soon as it was approved, I did make the transition over, and I was one of the top 5 graduates from the health informatics program. So it non-traditional. I've been in school forever, it seems. But it's been a great experience throughout the entire time. When I had to stop and really take care of my father during his cancer journey, I was supported the whole time. The professors still reached out during that time just to check in, which was so nice to have that connection with your professors, and always encouraging me and letting me know that when I was ready to come back, that they would work with me to definitely get it done. So I think that's a big pull to SUNY Poly, with it being not only online, which is huge because I live in Western New York. So being on campus every day is not something that would have been conducive with the situations, but also being able to flex your work around your full-time job. So yeah, I was there for many years. I graduated and then I did turn around and come back. I was fortunate enough to be asked to come back as an adjunct lecturer. So I was there for a few semesters and hope to come back. Looking for fall of 2026 to possibly come back in as an adjunct professor and rejoin the team. But the professors really do make the difference, I think, in the health information management and HI programs because they're flexible, which is huge. There were times when, and not that I would expect this from any professor, but there were times that I would be working on assignments at 11 o'clock at night, and in the midst of an assignment, I would send an email, not expecting a response. But lo and behold, by 12 o'clock, I had a response in my email kind of thing by one of the professors. So just amazing the flexibility that they do provide in the programs. And right now, where I currently am, we are actually just bringing in our programming into the statistical format, or stats are bringing that into our programming. And I am fortunate enough to have some experience with that through the HI program, and am able to actually transition and do a co-position with them at this time.
Thank you, Michelle. Stephanie Hisgen.
Hi, I'm Stephanie Hiskin. I'm the Chief Nursing Officer at Columbia Memorial Hospital in Hudson, New York, and I do apologize for the lawn. But I got my associate's degree at a college in the Albany area. And when I was looking at going back to school for my bachelor's degree, it was SUNY Poly at the time. And they had a program where they offered some in-person classes in Albany. And so I thought that it was really convenient, and that was kind of dating myself a little bit, but really before the time of a lot of online learning. We had some hybrid classes. But I think somebody on the call actually talked about the uh in the nursing, well, in general, the instructors. And I will say that many of the nursing professors that I had during my time really kind of shaped my journey. So I really enjoyed my public health courses when I was at SUNY Poly. I can still remember driving through campus doing my windshield assessment, and that really, my professors in public health really inspired me to go into public health. And I got my master's degree in public health, and then ended up getting my doctorate in nursing. And so I've done a lot of different things. And I think that is the beauty of nursing, that you go into the profession wanting to make a difference and caring for people. And kind of as you progress throughout your career, caring for people looks different in a number of different ways, depending on what you can do. So I really had the opportunity to grow from my experiences at SUNY Poly as I continued my education, and I worked for the New York State Department of Health. I worked in nursing recruitment at Upstate University Hospital in Syracuse, where we really were a clinical site, and then worked closely with students who were graduating to place them, especially with the nurse practitioners. Um, they then returned to the Albany area, and I ran a home health agency where I actually met Laura, and Laura is one of my former students, because was grateful enough to have the opportunity to return to SUNY Poly as an adjunct instructor in nursing. And then just continued my career in nursing administration, and it landed me here, where I still have close relationships with some of the students that I've worked with or taught over time and have worked with, and then also some of the professors as well. So very grateful for the opportunity, amazing experience, and it's so exciting to see where the college has grown.
Laura? Hopefully Laura can hear us. Just point in one second.
Can you hear me now?
Yes.
Okay, great. Hold on, now I have to leave this.
There's an echo going
Sorry
on though.
about that. There was a little echo there, yes. Hold on one second. Sorry, technical issues. Can you hear me?
Yes.
Okay, great. I apologize, you guys. My daughter was on my laptop and I think she unintentionally adjusted some settings. So it's a pleasure to be here. Thank you guys so much for asking me to participate. When I started at SUNY, it was SUNY IT, and all I wanted was a bachelor's degree, right? And then I quickly realized I could do this, you know? So after being accepted into the accelerated bachelor's master's program, I kind of took off. And, you know, prior to this, you know, I was an RN for 5 years at the time. I got my associate's degree from Samaritan Hospital School of Nursing in Troy. And, you know, being an RN, obviously, you know, getting your bachelor's is key. So that was my motivation initially for applying. So given I was an adult learner, you know, this was a really big advantage I felt like I had, because I felt like I was a little bit more prepared, you know, than the traditional student, so to speak. And, you know, having my professional experience as an RN prior to SUNY, I do feel I was more prepared, just generally speaking. You know, and as you guys have acknowledged, every student has, you know, life things that require, attention outside of school. And for me, as all of you have said, the faculty support through my graduate program and flexibility was a foundation for my success fully. The support and accountability is what really gave me real life preparation for my current role, where I do work as a family nurse practitioner for St. Peter's Healthcare in internal medicine. So, I'm kind of a variety of things going on in practice these days. But that being said, I didn't fully recognize at the time how this part of my educational experience and the support would later truly improve, my patient care and outcomes in my community, kind of on the back end in an informal way. I now recognize the relationships developed through the program with faculty and also with other students truly are still supports I utilize frequently for collaborative purposes, to this day. As Stephanie mentioned, she was my undergraduate research professor. We later happened to work together through visiting nurses. And it was while I was in my master's program. And Stephanie, like the other professors, Louise Dean Kelly and many others, were able to provide me, with much needed mentoring and guidance, not just educationally speaking, but from a career perspective. So, later being professional references for me and continually offering me support. So in addition to this example, through the SUNY Poly program, just gaining access to numerous colleagues, I have resources all over New York State to help coordinate care or that I can plug into for any sort of practice related questions that I might have. And the curriculum that was utilized also helped to train my mind for realistic practice in a clinical setting, which, these days is under continuous transformation. And, I am grateful for the foundation that SUNY Poly gave me to be able to kind of have the resiliency to deal with that, so that I can continue to provide the best patient care possible, right? So that is truly a reflection of my educational experience and background at SUNY Poly. I'm so happy that I currently also have the opportunity as an adjunct lecturer to kind of give back, to the students and hopefully provide them with the same support and experience that I had. Yeah, going from RN to master's in science, I mean, I couldn't have asked for a better way to get there. And definitely excited to continue to, like I said, give back.
Thank you. It's so great to hear that everyone has had such great experiences. And I always tell my students healthcare is a very small world.
Laru,
Really
Laru.
the healthcare
Dolores, Dolores.
is a very small world because everyone ends up knowing each other. So this is why students really need to make good impressions, especially their first internship. I have some questions prepared for you. So I'm wondering if I should call, if I just, I'll ask the question and like everyone can take turns answering. What are the biggest challenges you faced when moving from college to your first job?
Oh, I can take that. I can talk about my experience.
Yes.
Was a little bit different. So, from my perspective, I was already an RN. So, I think the biggest challenge for me at the time was that I was one of the few nurses who was going back to school to get their bachelor's degree. And so I think that there was like a lot of workplace challenges around the people that I worked with, like understanding why I wanted to go back, what the benefit was going to be to me, what the benefit was to them, and then kind of receive some of that encouragement and support. And I think sometimes as a nurse administrator, as a frontline nurse, I think we are all aware that nursing is tough, and we're in the business of caring for people. And sometimes I think we forget that we also have to care for each other in the process. And I think that was probably one of the greatest challenges that I saw during my time.
Anyone else, the biggest challenge you face when moving into your first job?
I can answer this too. I think one of the hardest things for me to learn was you started this new job and there's a whole bunch of people that you need to help as working in the HIM field. You support the staff that are working directly with the patients, and learning how to understand different personalities and how to mesh with them, and maybe, steer this person this way while it's the same thing, but you have to steer another person another way just because their personalities are so different. And I think that was really hard for me at the beginning.
I would echo some of that as well. I think also, just to add to that, translating all of the immense information that I learned specifically in my undergraduate, just about working and supporting youth, adults, in the realm of human services and in psychology and sociology. Just learning the impact that you have on the individuals that you serve. You go from being a student who is a sponge for all of this immense knowledge, and then you go into, at least in my first position, being a prevention specialist, being the person that is responsible for that education and that support. But with that being said, I think my foundation through community and behavioral health and through my professors provided an excellent foundation for that. Even though that was a challenge and it was a little bit scary in the beginning, I quickly realized that all of the knowledge, the practical experience, and the support that I'd gained from my professors and from my classes was just what I needed to be able to support those students.
I think I have to acknowledge the fact that I did graduate in 2019 in the spring and hit the ground running, as far as the job went, pretty well and feeling pretty good about where I was at. And then I would say the biggest struggle I had several months later was COVID hitting, right? So being in a clinical setting, and as all of you know, the uncertainty and just chaos of that moment, I do feel like that was quite the awakening. And, at that point, having been an RN for 10 years, even, what do we do with this? How do we approach this? So now, having experienced it, obviously, the positives that came out of it, other than learning how to kind of navigate through a pandemic unexpectedly. For me, an example is having the confidence to, I was asked to work in a different suite to cover for patients for a physician that had to be out because of COVID for various reasons, and just seeing patients that weren't even mine in a primary care setting, and just kind of molding into whatever role I kind of had to do at the time. Also, piloting the first COVID vaccination program at my office, was pretty cool too, just to be able to, do something at the time to help the community. Most of the time kind of feeling helpless there for a while, not knowing where to go with things. But I do think that COVID was a big challenge for me, conceptually, and hopefully we don't have to experience that again, but that would be mine.
Yeah, I can just say that, I had my position before I graduated. So I was there working several years before I went back to school. But when I was going back to school, because I work in a little bit different field. I work in research, I work in a data management center. So I'm not patient facing. I'm in the background. So I'm gathering all the data for these clinical research trials, and we're coding them, and we have to code them in a Medra coding set so that we can submit our reports to the FDA and work with our DAIDS medical officers and things like that. So as I was continuing through finishing up my bachelor's degree, the expectation from my supervisors at the time was, okay, now you have this in your back pocket. We now need you to do this kind of thing. And that progressed right on through. And after my promotion and getting my master's degree in health informatics, then it truly did progress into, we know you have some background in SQL. We know you have some background, like I said, in R. Right now, they're moving me into that transitional period with our statisticians to work with them with the programming for R, to see what that can bring to our data management teams. So it was it's been a building thing. So we know you have this information in your brain now. So now we're going to pull and use it from you. So the expectations have shifted and changed throughout the years, knowing the knowledge that I've gained from SUNY Poly.
Thinking back to your time in college, what class do you wish you would have taken?
I'll jump on that one. I wish I would have taken a couple of more public health classes. You don't realize, I guess, at least in my field, you don't realize right away how the public health actually translates into a lot of the research that we do. So I think that would have been helpful.
I think for me, one of the things, and it was probably just around the timing and the curriculum may have evolved since, was around electronic health records and a little bit of health information management, and just think all of that experience related to nursing informatics is just taken over the world of bedside care and patient care. And I think just having more knowledge in that area is just such a benefit to the frontline staff who have to interact and interface with the electronic health record and patients and all of the equipment. So I think technology is just huge. So I think that would be one thing. And sometimes I actually think about going back and just taking them out of curiosity.
For me, I wish there was two things. I wish I took more like computer classes, because a lot of times I get asked questions just because being friendly, people want you to help them on how to fix their computers. So I wish I knew a little bit more on that stuff. And then I also kind of wish I did more like mental health classes, because sometimes being friendly, like staff want to talk to you about personal things, and sometimes I just don't think I have like the tools all the time that know how to answer it. So I kind of have to steer them towards like a social worker to talk more about that. And I think social workers are really important in our facility. So I wish I had a little bit more classes with social work type stuff.
I think for me, I wish that I had had more time at SUNY Poly and more time with the CBH program, specifically as far as the CBH practicum courses are concerned. I did have the opportunity to participate in several of those, including some of the special projects I mentioned. But that practical experience was so crucial in preparing me for my work in the workforce. So I would say that if I had a chance to go back, I wish that I could have done even more of those than I had the opportunity to participate in.
I think all of you gave us some great ideas that we can incorporate into our programs. So it's very interesting. If you could give one piece of advice to current students preparing to enter the job market or the workforce, what would it be?
I would say take the opportunity while you're in the programs that you're in to really focus on building collaborative relationships with your not just co-students but faculty. As you know, again, we've all said the importance of the faculty support, etc. I just think that, really echoing to students that these are going to be your colleagues when you're done, potentially. So just, gaining those relationships, I think is just a very important thing. That's just an aside. So that would be my suggestion.
I would second that. I think the connections that you make in those formative years while you are attending undergraduate, you never know what connections and what pathways and relationships are going to lead to future opportunities for you, future collaboration projects. So I would say just the importance of, again, like Laura said, building those relationships with your professors, with your peers, and as well as the supports that are available on campus as well.
I also agree that that's extremely, extremely important to build the relationships, because you tend to work with people that you kind of went to school with, and you could need to collaborate with them later on. So it is very helpful to have those relationships. And then my other piece of advice is, once you start your job, to learn as much as you can, even if it's not on your program. My great uncle, who's still alive, he's like 102 right now. He gave me that advice before I started my job here. And he said, don't ever say no, always learn, so that someday you'll be the person that everybody comes to and you'll be able to help them.
I always say apply for the job that you want, not for the job that you feel you believe you're qualified for. In my experience, and I know I've had a couple of graduates text me later on saying, I applied for a job that I knew I wasn't qualified for, but they offered it to me. I think sometimes we are, as individuals, we're our biggest critics. So maybe you don't feel that you are truly have the qualifications for a position that you really want, but you don't necessarily know. So the worst that can happen is they don't offer you the position and you apply for something else. But apply for the job that you want.
Stephanie Hickson, do you have any advice for students that are currently preparing?
Sure, it's a little loud here, so I do apologize. I think I would agree with what everyone said. Relationship building is huge. And the world is actually small. So you never know when you're going to need to rely on those relationships in the future. The only other thing I think is, along with applying for the job that you want, you need to be authentic to yourself. Because if you find a job that you love, you'll have never worked a day in your life. And I think that is very true. When you have a job that you truly, truly enjoy going to every day. And it might be a little bit hard to find that, and you might have to do a couple different things along your journey, but that's the best advice I can give.
Some of you have already answered this, but how do you think that SUNY Poly gave you an edge in the field compared to your peers that graduated from other schools?
Take this one. I think CBH as a major is so diverse and it's so comprehensive in what it provides. It provides you practical experience. It gives you the theoretical foundations. It gives you the basis in both psychology, sociology, and biology as well. I would say that I was prepared to tackle any career that I wanted. And when I initially came and was interested in SUNY Poly, my interest was in entering the medical field. And within 6 months of being in that CBH program, my eyes were opened into just how many possibilities there were. Sorry, guys. To entering the helping field, to entering human services. So I would say just the diversity of the program itself was a great prep.
I second that in a way that I was able to, living in Albany, meet people from Western New York and really connect with people from all over the state. And even now, still doing that with students, you know, that I'm teaching. I think that's really cool. And I don't think that I necessarily would have had that experience and that edge had I gone to a local program. So I'm definitely appreciative of that.
It was the reputation when people kind of see, I think that definitely was something. And I feel like at the time, SUNY IT for me was one of the very few colleges that was offering a bachelor's degree. So I think in just in general, it stood out from there.
Stephanie or Michelle? Stephanie DePerno. Sorry, we have two Stephanie.
No, I mean, I agree. The diversity of the programs, the variety of coursework that you take within the programs, it really helps build you as a whole. It gives you different ideas, different aspects. HIM has come so far from where it was when I started in 2011. 2011, we were in the records department, and that was virtually it. You were coding kind of thing, where now we're really out in any area of the hospital moving, and informatics, as somebody else said, is just kind of taking over at this point. Data collection has become such a huge factor in everything, and really driving how things work within patient care. So I think the diversity and the vastness of the different level of courses that you take really gives you a well-rounded feel. And I absolutely agree with the relationships that you build throughout. They can definitely help along the way.
And I also agree that SUNY IT and then SUNY Poly made me really well-rounded, especially the master's program. A lot of the classes were geared towards things that weren't traditionally like HIM fields, but I was able to learn them. And I think that that really helped me overall working at Central right now, that I'm able to help with different areas. So it helped me for my future. And I thought the MBA program was great at SUNY Poly. So I was really happy that I got in and I did so well and continued my education. I think it's just, in my opinion, all students should at least try it, just because it gives you something else that you touch a bunch of different things that you might not think of with your undergrad.
How do you see the health science field evolving, and what should current students be preparing for now?
So I think from the perspective of frontline nursing, we are becoming more technology driven. And I think that there's a lot around artificial intelligence that is coming forward, and really how to interact with that in the clinical setting. I remember Dr. Sellers once telling us when we were in nursing leadership that the world is always going to need nurses because a robot cannot take care of patients. And that is true, but we use robotics in so many different ways. And I think all of the technology that we're facing is can be a challenge. It can be challenging to staff, especially, I will say, people are so used to technology that when something goes wrong, we don't know how to interact without it. So that also is something that is a potential, but I would say certainly we have seen, especially since COVID, just such an evolution around artificial intelligence and technology and leveraging the care of patients in the clinical setting.
And I agree with that as well. At my facility, we're moving towards a more electronic health record. So having all of that technology and how things are changing and being able to evolve with it, that's extremely, extremely important in our facility.
I would say technology as well. Technology is and data collection are a huge component of my current role and how we evaluate our program and how we translate that into effective programming that supports our students. And I would also say just observation and adaptability in the changing needs landscape of Oneida County, Herkimer County, whatever region that you're working in. Just the changes in need from the population of youth that I worked with from my time at CFLR 3 years ago to my time now with the Liberty Partnership Program in Herkimer County, the needs are ever increasing and the need for support is at an increased risk as well.
And I agree 100%. Technology is a driving force for sure, and it's changing. It's ever changing. So being able to have an outlet or work within an organization that gives time to learn that new technology and not just anticipate that you know it kind of thing. I think that's huge. And I'm very grateful for our organization. They do a lot of great training and ahead of time before they will even deploy anything to us. So I think that's important that, yeah, we're very technology driven. It seems like all of us in the different courses at SUNY Poly, and we come out with a really strong mindset of technology. But I think the different programs that we touch within the school also allows us to learn how to adapt programs maybe a little bit quicker than other people that have kind of been in the field doing the same thing over and over for years and years. Change is scary, so adaptability is important.
I agree. I think technology, obviously, I think the big gap for me in the future of medicine, having direct patient contact on a daily basis, is like, where does the human interaction fit with this technology? How do we capitalize on the technology, right? To see more patients, given we don't have enough providers, we don't have enough nurses. How do we find that balance, right? To still connect with people, because people can talk to a robot, get their antibiotic, and move on. But at the end of the day, did they really get what they needed without that human contact and without that true connection? So for me, I feel like that's what we have in medicine, and that's also kind of the mystery of the future, right? Is how that will be incorporated. So, and then I do agree with the documentation piece. I have the ability to sit in a room and have AI generate my note for me if I would like. So I'm not typing during the visit and these types of things. So, I do feel like we're moving in a great direction in that way. It's an example of how something like that could free me up more to just have that interaction, right? So I think if personally, I think if we continue on that path, I think we'll be successful, but maybe not. I'm just interested to see the research that comes out to support future of both of these things.
What professional development opportunities like certifications, workshops, continuing education have been most valuable since you graduated?
I'll jump in here. Having my RHIA certification has been an immense help throughout my career, but the continuing education through a HEMA has been huge. Attending the HEMA conferences is they're great networking opportunities. You get to speak and meet people that you probably wouldn't have had that opportunity to do so outside of your local environment. And for me, again, I work in a data management center. I'm at patient face-to-face patient all the time, but I have to understand that realm of face-to-face patient because our sites, our clinical research sites, they are patient facing, and we have to be able to understand their communications with the patients and how they translate back to us. So yeah, definitely having that certification and knowing that there are requirements that you have to stay up to date on things. It helps with the ever-changing environment.
I actually fall back on for continued ed, the same products that I used for my board reviews for my nurse practitioner certifications. I find them to be very continually helpful. Margaret Fitzgerald in particular, for nurse practitioner world is truly, you know, just updating constantly and giving you the most, evidence-based information, et cetera. So yeah, I kind of stick to my roots in that regard. But that is very helpful, Margaret Fitzgerald.
I think any of the professional organizations, so I'm a member of the Organization for Nursing Leaders, but any of those organizations where you have access to continuing education, they have the most up-to-date information related to clinical practice or administrative practices. And I think they're just like a wealth of information. I also would say that just continuing my education was huge for me after my bachelor's degree. And I often will say your experience is kind of what gets you the job, but your education is what gets you the interview. And I think that that has been probably one of the greatest things for me.
I would say continuing education as well. For the last year, I have been studying my master's in social work through Kiuka. And that has been such a great complement to what I learned in CBH, and the opportunities and trainings that that has provided in tandem with the opportunities for training I had as an undergraduate and as a professional as well. One that has really stood out to me that's been great foundational as well, was the mental health first aid certification as well. So that's just identifying trends in mental health with youth, learning how to do mental health crisis management, all of which has been very beneficial to me, working in school districts and working with youth, and now in training my staff to do the same as well as they continue to support youth in the community.
I agree that the continuing education is also extremely important. With the HEMA credits that we have to do, you can pick things that are geared towards your workforce. So I'll usually read articles and take quizzes based on those. And it's always helpful for me. And sometimes I save the articles so I can use it in the future. And then sometimes you can go to conferences and they do talk about things that really apply to your workforce. So I think it's just important to have the continuing education and keep up on your certification.
How did you handle setbacks or rejections especially early in your career, and what helped you stay motivated?
So I think in regards to just setbacks and kind of experience, when I was in I'll say in administration, you tend to kind of experience some of those changes a little bit more rapidly and a little differently. And I think one of the experiences that I had was gone through a position elimination. And it's like an interesting dynamic once you've kind of been in administration. And, I often tell nurses, like, you always can go back to the bedside no matter where you are in your career. And that is true, but you also at the same time are a little bit removed from that. And so, that maybe not necessarily is always the fit that the organization may be looking for. And so I think one of the things that kind of helped me during that time was one, I was able to remain as an adjunct at SUNY Poly. So I think that was very helpful for me because I was still able to have a part-time position and was working with students, and so I was able to keep busy. And then also just interviewing. And so I think during that time period, I had like 4 or 5 of the best interviews I ever had in my career. And I think those are the things that help. And I think that now, knowing that years later that you've gone through an experience like that and you've come out on the other side stronger, and have had a lot more success, you know that if that is ever to happen to you again, that you will get through it. And so I think you have to rely on your peers and your support systems to help you, but you do get through it.
I would say just being mindful of your own individual resiliency and perspective as well. Some of the biggest setbacks that I've had in my career, especially being a young leader and being in administration as well, is navigating major changes, especially because we are a small team. We have a big mission. Most recently, I can think we had a change in staffing. And at the outset of that change, it kind of looked like this challenge would be very difficult to overcome. And how would our team redefine, and how would we redefine our impact in schools, and what would that look like? And what it actually ended up being was a new opportunity. So it was a new opportunity for me as a professional, for my program to realign and to shift a little bit, and for us to welcome in new talent and new perspectives as well. So what initially seemed like a huge setback or a huge challenge, just through a little bit of perspective taking and through understanding resiliency and what that means, not just individually, but in a collective team, realizing that those setbacks can often be new opportunities.
And I also agree that setbacks, they create new opportunities, but they also create a way for your team to come together and collaborate on how to make changes, kind of like what you were saying, like how it kind of like makes your team stronger because you guys are working together and everybody's collaborating and you're trying to get past this little hump of whatever the setback is and maybe come up with a fresh idea together. So it's a real team bonding experience.
And
I think-
yeah,
I
I
think a setback-
certainly agree with that. We just went through we've gone through 2 rounds of layoffs actually with all the government changes and grants and things this past year. It's brought a lot of fear within our organization. You know, we're funded to a certain period of time, and then at that time, you know, are we going to get renewed or are we not going to get renewed? We've reduced staff, like I said, twice now. So my team has shrunk immensely. I'm down to 2 people in my team. It's me and one other coder at this point. So definitely being able to adapt and know that hopefully there is an end in sight, and looking forward to what that future might hold. And then the regrowth opportunity of it. You know, eventually I am going to be able to add my team back, whether it be adding those individuals specifically that I lost, or the opportunity to bring a freshness in, to bring fresh personnel in and move things into a new direction. So I think it's just that knowledge of, yes, there is an end in sight. It's just may not be right this moment.
Echo that, you know, uncertainty with the political just feel recently, right? I think my biggest setbacks are not having resources for my patients, right? And then not having the staff to help me coordinate for missing pieces to the puzzle, right? So it is a huge opportunity for a structural you know, coming together, and a system coming together, so to speak, on a bigger level. And, you know, obviously all of our individual roles are important, and we all, you know, we all need to do what we're here to do. But at the end of the day, I think that there's definitely some growth pains going on just with the insurance industry, right? And what they're covering, and just the ability to connect people to what they need. You know, clinically speaking, we're all impacted by this one way or another, right? Whether it's our family member or it's my patient. You know, I think that this, systemically speaking, is going to be a big opportunity for growth, and we're really gonna have to stretch our brains a little bit to find a way to be resilient here, and definitely interested and here for it. But it is a little bit of a setback in the meantime, I think, overall.
And thank you. And before I open this up for questions, I just want to pull up, we have a little survey here. So once you can answer and tell us how you thought our panel was. Does anyone have any questions for our panelists? Or comments, questions, comments?
I've really enjoyed hearing, listening to the stories. I just found it real interesting. One of the questions that Andriana asked about is thinking back, if you were back in college, what would you do? And it was interesting that there was a lot of crossovers. We had someone who from health informatics saying, I'd like to take some more public health classes. Some people in nursing say, I'd like to take some health information management classes. We had, I think, the nurse talking about we need to have, like to have some more mental health classes. So it's real interesting that for those students that are here, there's a lot of crossovers between our disciplines. There's a lot of uniqueness, but people in the health-related field, they are constantly collaborating with other people. So the more you can get an understanding of their area of interest, if you have electives, you know, we do have courses that you can take. So I found that interesting.
We do have a question in the chat. So as future health information and public health professionals, how can we prepare for a landscape where large health insurance payers increasingly control hospitals, provider groups, and care delivery models, potentially prioritizing volume and cost containment over quality of care? What skills, strategies, and advocacy efforts should students develop now to navigate and influence the shift?
Utilizing your documentation system appropriately, really learning how to code appropriately, and really learning how to use your modifiers appropriately to reflect the level of complication of health that people are facing, to really show the insurance company these patients are sick. They do need the services that we're requesting, or what have you. So I would really, I do stress to my students the importance of that, just accurate documentation in your note, but also with the billing to ensure it's reflecting the reality of the situation that you're seeing with your patient.
I was taken by two themes that I heard consistently throughout all of your conversations. One was the emphasis on the importance of relationships. And that's absolutely true. You have a lot of evidence to support that on a number of different levels. So that I think is something that from a faculty point of view is something we can nurture and develop more. That's number one. Number two, the other takeaway that I came from is the importance of incorporating technology and showing that human interface. How do we use technology in the best way to advance our humanistic goals? And you know, that's that is a struggle. There's no question about it. I know in CBH we are attempting to do that. We did initiate a course that looks at technology and healthcare, and in our proposed PsyD program, there is a required course on technology and healthcare. I don't know how well we're doing it at this point, but I do think you're absolutely right. We've got to address those issues. Otherwise, we're going to be lost in the future. That's for sure.
Nope. Okay. Nope.
I think
Sorry.
also back to Michael's question
Wrong hand.
about what should they learn. I agree 100%. We have to ensure documentation is accurate as far as in the HIM field and the coding and the billing of things. I think being able to ask questions about documentation is super important. So developing those relationships from the back end staff to the front end staff, being able to get questions answered when they need to ensure the accuracy of the code sets. We have to kind of acknowledge that there is a political government presence now setting standards and payments and rules and regulations, and there seems to be more and more rules and regulations coming out all of the time that not only physicians and providers have to follow, but clinics and hospitals have to follow. So with that ever-changing landscape, knowing your role and prioritizing the knowledge of that role and utilizing your skills is super important to be able to ensure the organization as a whole is functioning and profiting as much as possible.
Louise, do you have your hand raised?
Yeah, sorry. Before I had my clapping hands up, the wrong one, to talk about technology problems here. I wanted to comment because I agree with Joanne. It looks like in the importance of communication and technology, and sometimes they clash. You know, our older nurses are having trouble keeping up with the technology, and we need to teach them a lot about that. But the newer ones coming out are wonderful in technology, but sometimes they don't even know how to talk to a person because they don't talk to people anymore. So that's a real problem at both ends. But it is something that nursing also has identified as a big problem, so that we're trying to incorporate some more of the technology in the programs. In fact, this afternoon, I'll be doing an AI thing with my students in lab for the first time. It'll be interesting. But the other part is it's so hard for them to learn how to talk to their patient. It's hard. So it is a problem. Yeah. I'll take my hand down if I can find it. Here we go.
Kelly, I agree with you. When I take students on and precept them, one of the things, I don't care what semester they're in, I kind of put them through the ringer a little bit the first couple times, just obviously for obvious reasons, right? And in a respectful way, of course. But before we even get to, oh, this is how you diagnose, this is how, can you touch a person in the setting of being a provider? Can you talk to a person as a human being? Can you not just sit there in front of your laptop and say, do you have any eye issues, ear issues? Are you short of, not doing the robot thing, right? And making it a conversation, right? How's grandma doing? Okay, cool. Oh, any shortness of breath? No. Okay. So anyway, how are the kids? But also doing it timely and efficiently. I do think it's an art, and I do think that
It is.
a lot of nurses are struggling with that, and I do see it with even master's level students sometimes. But I do agree with you. It's definitely something we have to continually address for sure.
Does anyone else have any comments, questions, or maybe our panelists would like to add something? I want to thank you all for joining us. Especially wanted to thank the panelists for taking the time out of their busy work schedules and supporting SUNY Poly and our students and our future students. And I want to thank everyone for joining us today.
Yeah, this was great. Thanks for everyone. Please also use the evaluation that's still up on the screen to give us your thoughts. So again, thanks to the presenters. We appreciate it.